My name is Dr. David Rahimi. I'm a dermatologist and cosmetic surgeon in Los Angeles, California, and I'm going to talk to you about acne and acne scarring. Millions of people all over the world suffer from acne and acne scarring. Now, acne is a normal thing. We all go through it. Most people do great, but a small percentage of people end up having scars that changes their entire life. It defines their life. And I'm here to tell you, if you have acne and acne scarring, we can help. If you've been told that because of your skin color, your acne scarring cannot be treated, we can. If you've been told that your scars are too deep or too difficult and they cannot help you, we can help you. I've done this for over 22 years. We have 32 different laser and light sources, and we can put a program together for you, especially for your acne and scarring, to treat your skin. Now, I'm going to be frank with you. It's not going to be easy. Sometimes several modalities and several treatments are needed, but it can be done. And I'm here to show you how. As a dermatologist, I am uniquely equipped to diagnose and treat your acne and remove your scarring. Basically, there are 4 components to acne. Acne can be environmental, genetic, hormonal, or bacterial. So when we get together, we decide what type of acne you have, and let's say if your acne is bacterial, we treat it with antibiotics, topical or oral, benzoyl peroxides, and things to get rid of the bacteria. So once I've addressed the acne, I start working on the acne scarring. And basically, there are 4 different types of acne scarring. There is ice pick scarring, where it looks like somebody took an ice pick and made little holes into the skin. There is atrophic, rolling, and what's called boxcar scarring. And every type of scarring requires a different type of treatment. You can't treat ice pick scars the same way you would treat atrophic or rolling scars. It's actually quite fascinating. When I treat an ice pick scar, it's as if I'm taking the hole inside of a donut out. So I have a special instrument, it's called a punch, and I take the hole out, stitch it together, and then laser over the scar later. Atrophic and rolling scars develop because you have a little cyst, and the body secretes enzymes to get rid of the cyst. And what happens, those enzymes actually eat away at the skin and cause a little indentation and a little scar tissue that's pulling the skin down. So we have a special needle that has a tiny knife at the end of it, and we go underneath the skin and we cut this band, and the skin puffs up, and what you can see is that the scars fill in. And in real life, things are a little more complicated. Usually you have 2 or 3 different types of scars. So I may be doing a little subcision, a little punch excision, a little punch grafting, so we mix and match depending on your type of scarring. So I have patients who are super busy and have no downtime, and we have lasers that require no downtime, such as cool touch laser or dialight laser. Several treatments over a few months are necessary, but gradually the skin fills in from inside as the body makes new collagen. Then I have patients who can take a weekend off. They can take 2 or 3 days off to recover. So I have devices and lasers that have minimal downtime, maybe 2 or 3 days of peeling and flaking and scaling, such as Venus Viva nanofractional radiofrequency. 36 tiny little needles go underneath the skin, and the energy of radiofrequency is injected into the skin, and the body fills in the scars from underneath. Like I said, 2 or 3 days of healing, and results are incredible. 2 or 3 sessions over a few months with significant improvement. And then I have patients who've been to a lot of different dermatologists. They've done different things. They want something aggressive, and they're willing to stay home 5 or 7 days to heal. And I offer them things such as mixed-2 fractional resurfacing. Basically, a special laser that's designed for sensitive skin that goes underneath the skin. 6 or 7 layers of the skin are removed. The skin looks red and raw, like the worst sunburn you've ever had, and then everything fills in from underneath. So again, we look to see what kind of scarring you have. We put a program together that matches your lifestyle and gradually improve your acne and acne scarring. Here at Forever Young, we have 32 different laser and light sources, so we can individualize a plan that will treat your acne and acne scarring. We have aggressive lasers such as mixed-dose fractional CO2 resurfacing and erbium that take 5 to 7 days to heal. We have conservative lasers with no downtime such as Cool Touch laser, Cool Touch CT3 and Dialight laser. We have microneedling. We do something called PRP, where we draw your blood, spin it down, take the stem cell and platelets and inject it back into the scars. We offer 10 different types of chemical peels, very light peels from glycolic facial peels to TCA peel and Gesner peel, and very aggressive peels such as phenol peels. We have 10 different types of fillers, from very thin superficial fillers for very superficial scars such as Restylane and Juvederm, to Sculptra and Bellafill, which is a permanent filler, millions of tiny little plastic beads that go underneath the skin and gradually fill in the scars over many years, and they're safe and FDA approved and permanent. So you have to go to a dermatologist who has all these lasers and gadgets in his armamentarium to help you put an individualized plan for your acne scars. If it works and is safe, we offer it at Forever Young. One of my pet peeves is something called TCA Cross. Stay away from TCA Cross. What's TCA Cross? Some practitioners dip a Q-tip in acid and touch the base of a scar, hoping that your body will make new collagen and fill it in. But invariably what happens, if you think of a scar like this and you put a drop of acid at the base of it, the drop also touches the sides of the scar, so the scar becomes wider. Every week I see patients in my office who've had TCA Cross who are very unhappy and have worse scarring. So stay away from TCA Cross. You need to find a dermatologist who pays a lot of attention to detail. Every face is different and people have multiple types of scars. Your dermatologist needs to take high definition photographs, look at each scar individually and put a plan together for you. I've treated over 10,000 patients in the past 22 years with severe acne and acne scarring. I've written a small book explaining my approach and showing my before and after photos. And if you email me, I'll be happy to send you a complimentary PDF copy of my book so you can read about me. Many of our patients have also left reviews on sites such as acne.org and realself.com with their experiences. So you can go on those sites and see what my patients are saying about our practice. I want to finish my talk by telling you something that's really dear to me. Don't let acne and acne scarring define you. Every week I see patients in my office, young people who don't go to school, don't go to classes because they're depressed, because they feel like their life is over. Don't let acne and acne scarring define you. Find somebody who knows how to treat your acne and acne scarring and have them put a program together for you and remove your scars. Don't let it define you. Over the past 22 years, I've treated over 10,000 people from all over the world with acne and acne scarring. We've had people flying from China, Japan, Fiji, Hawaii, all over the United States to have their acne and acne scarring treated by us. Email me. I'll personally communicate with you and put a program together for you. We'll prep your skin where you are at home, and then you can fly in and have your acne and acne scarring treated. So I hope I was able to give you a little taste on how to treat acne and acne scarring, and my staff and I are here to help you. Thank you.